So I'm watching episode 5 of the Pitt, and the nurse case manager is there. And again, this was like very similar to the job that I did when I worked in the hospital. Except I didn't really deal with insurance because, I'm in Toronto, Ontario, Canada. We have OHIP. Also, shout out to soft nursing in the ED. But I did think it was really interesting how, her and the med student got, pretty creative, and she used the words, thinking outside of the box when it came to, supporting the patient and getting them out of the ED and still getting them the care that they needed. That was very, very similar to, the job that I did back then. Like, I had to work with very limited community resources, and I got all this pressure from the hospital back then to really just like get them out of the hospital, and they would always like tell us to think outside of the box, get creative, things like that. So specifically in the show, the med student was like, okay, maybe he doesn't need to be in the ICU to get the insulin drip. Maybe he could go to a med surg unit where price would be like 2/3 cheaper or something like that. And then the nurse case manager talked to the charge nurse and like switched the IV insulin drip protocol to something else and lowered the cost.